Let's talk about cupping and bloodletting. Cupping was invented all around the world pretty much at the same time. Therefore, we are not really sure who came up with it first. We just know it was so effective and obvious. A lot of people came to the same conclusion at the same time. Cupping is the use of glass or plastic cups that are being placed in various locations on the patient's body, while the therapist is sucking the air out of the cups, using either fire or suction pump, and therefore creating vacuum that pulls the skin and tissue into the cup. It can also be used in a treatment called Gua-Sha, where the therapist first rubs oil on the patient and then slide the cup back and forth over the problematic area. Cupping usually feels very nice, but for some sensitive patients it can also be a little bit painful, depending on the intensity of the suction and the number of cups. Cupping is usually used to treat excess in the body, sore muscles, inflammation of joints, pain, rigidness, pulled muscles, and more symptoms of that nature. The treatment is considered very effective and is used in many health-related fields. Bloodletting is an ancient art of medicine. It is comprised of drawing blood from the patient's body in small increments. When invented, it was quite common to use leeches for that treatment. But with time, our tools got better and more precise. Nowadays, we have specific sterile needles for that. Bloodletting is amazing at cooling the body, lowering fever, replenish blood flow, clean toxins from the body, as well as helping with morsels, goiters, warts, and many other issues. Sometimes those two techniques are combined in an intensive, specialized treatment, where the therapist is using bloodletting needles to puncture holes in the problematic areas of the patient and then placing suction cups over them to intensify the bloodletting effects. I love both of those techniques very much. I use them on myself and on my patients, and I highly recommend it. Using either fire or suction salute